Welcome to this module. So here we're going to be talking about assessment of vital signs, which is also part of the minor roles that you perform as a nursing assistant. We assess their vital signs. Now, let me ask you, what are the examples of vital signs that you know? Temperature, blood pressure, pulse, what else? Pain level, respiration, etc. So we're going to take them one after the other. We're going to start with temperature. And for temperature, we use a thermometer. We have both the manual thermometer and the digital thermometer. All right. No skill is required to use a digital thermometer because it's simply to press a button, place it under the armpit, then get the reading. But for a manual thermometer, we require some skills. Now, we also have different types of digital thermometers. We have the non-contact forehead digital thermometer. Then we have the infrared in-ear digital thermometer. All the digital thermometers are very easy to use and no skill is required. Just press a button, put them in the appropriate places, and it gives you a result. But for manual thermometer, you need to understand how it works. So if you look at this manual thermometer as we see on the screen, in between there is an obvious yellow line. There's an obvious yellow line. You don't need to stress yourself to see it. It is just there. But if you look in further, you will see underneath, within the yellow line, another metallic silver line. That metallic silver line is called a mercury. Now, when you place this manual thermometer underneath the armpit of the patient, after a while you take it out, wherever the mercury has gotten to, wherever the metallic silver line has gotten to, that is where you will take your reading. Okay, that is where you will take your reading. When it comes to writing down the results from vital signs, you will either have a positive reading or a negative reading. I don't know if you have ever wondered why healthcare practitioners will always have a red pen and a blue pen in their pocket. That is because red pens are used to record negative readings that require the attention of a healthcare worker or requires the attention for something to be done. Red pens are used to record negatives, while blue pens are used to record normal positive readings. If there is a negative reading and you mistakenly record it with a blue pen, making whosoever on duty or whosoever takes over from you not to notice it because it's on a blue pen and something goes wrong, you will be held responsible for not recording a negative reading with a red pen. So negative reading with a red, positive reading with a blue. Now with our temperature, which reading is negative and which reading is positive? The range for a temperature is 35.9 to 37 degrees. Anything less than that, anything more than that is an abnormal reading. It has to be within range, meaning from 35.9, 36, 36.1, 36.2, 36.3, all the way to 36.9, then 37 is a normal reading. Now, kindly note, the range can differ based on countries, based on weather. The hospital where you work, the facility where you work will always give you their own range. We've had a lot of persons who will tell you for their hospitals, their range is 35.9 to 36.9. But for the sake of this training, we try to use the WHO World Health Organization standard to teach. But the range will differ. You must use the range of your facility and record appropriately. Where negative is negative, you use the red pen, and where positive means positive, you use a blue pen. So be mindful of the range. If you forget the range, you will not know when it is a negative reading or when it is a positive reading. Let's move to the next vital sign. We have a pulse. For the pulse, we use what is called a pulse oximeter. This is called a pulse oximeter. This is what we use to check the pulse of our patient. On the index finger, just place it over there and press a button. As simple as that. It takes the reading and you take your reading easily. But a situation whereby you meet an accident scene on the road, you don't have a pulse oximeter with you, and you need to check someone's reading, what do you do about that? You can use your finger, and I'm going to show you how that works. Okay, so with the pulse oximeter, what is the range? What is negative and what is positive? So for your pulse is between 60 to 100 beats per minute. 60 to 100 beats per minute. So if you have a 78, that's positive. 90, positive. 101, negative. 53, negative. It has to be between 60 to 100 for it to be a positive reading. So I mentioned a situation whereby you do not have your pulse oximeter with you. You meet an accident scene, you want to check if the person is still breathing, the person is still alive, what's their heart rate, whatever you want to do, and you don't have this apparatus or this tool with you, you can check different ways you can check. Okay, so you can use your index finger and place it by the left hand side. Now, why do we always check beats on the left hand side? Because your left hand side is the closest to your heart than your right hand side. So you get your hand not at the middle, a little bit to the left, press down that place. Can you try it? Let's see if you can feel your beats. Left hands, please. Left hands, please. Okay, so press it down. Press down. Don't be scared. Press it down with your 2 index finger. Can you feel your beats? Good. Now, you have to count this. How many beats you can feel in 60 seconds. How do you get your 60 seconds? Either you use your stopwatch or you look at the clock. That is why most nurses will always have their clock on their chest, right? So you have to look at the second hand. The second hand is the one that moves obviously, okay? So if you start at 12, it has to go around and come back to 12. So from that 60 seconds, how many beats did you feel? Can you count? So you're counting the beats and not the movement of the clock. So the clock is just to help you time 60 seconds, but what you are counting is the beats. And how many times it beats in 1 minute is your reading. So 60 to 100 is the range for a beat. Another place we can feel this very easily, if you come from your what you call Adam's apple, just go a little bit underneath here. This usually easy to feel. I heard someone say that if every other place you can feel it and you cannot feel this one, it means you're dead. So if you can't feel it, you're so alive because you can hear me. So somewhere, either this slope, this deep part here, you can feel it. Then here again, can you all feel it? All right. Great. So you count the beats, and that is how you take your reading. Let's proceed. The next will be blood pressure. To check our blood pressure. So to check our blood pressure, we need a sphygmomanometer. All right. So this is a sphig. I know you are used to calling it a BP apparatus. This is a sphygmomanometer. That is what it is called. And this is a manual sphig. And this is a digital sphig. So a digital sphig is very easy to use. No skill is required. It's just to put this round the left hand and press a button. But about how to place them. Okay, normally you should have what is called an artery indicator label. This artery indicator label shows you what should be placed here. So the first thing you want to do is to go this way using the artery indicator label and place it there before you wrap round. But a situation whereby you have a sphig that does not show you any sign of an artery indicator label, how do you know where to place it? The tube connectors, which is this, is your easiest bet of discovering where the label, the artery indicator label is. So you go this way, place it around the hand, and you wrap it round. With digital speak, it's very easy. Wrap it round and just press the button, and it just starts to read. It's reading, though it's nowhere, so it's going to give me an error reading. Yes, it just did. So you put that around the hand and press your start button and take your reading, as simple as that. But with the manual speak, you're going to use your stethoscope as well for the procedure if you have to go manually. We have a lot of persons that believe that the manual gives a more accurate result. I'm not of that school of thought though, but I love to use manual. Sometimes I have to use the automatic. So you place this round your ear. Okay, then you wrap this round. So let's assume this artery indicator label is not here. This tube connector helps, show us the closest place to put that. So you put this, you wrap it around the hand. During the practical class, we're going to all do this together, okay? So you just wrap it around a hand, then you inflate with the inflation bulb. You inflate, and this is the gauge, all right? So as you inflate, the gauge actually moves, right? It moves. So you inflate until it goes to somewhere really high. Maybe it gets to 240 over 220. You inflate. Then after a while, you release gradually and allow it to come down. The gauge keeps coming down gradually. When you hear the first beat, that is your first reading. Then the final beat is your last reading. Now, what do I mean by the first beat and the second and the last beat? When it comes to fraction in maths, for example, we have 120 over 60. In mathematics, 120 is the numerator, right? And 60 is the denominator. But in this space, 120 is called the systolic, while 60 is called the diastolic. 160, the upper part is the systolic reading, the lower part is the diastolic reading. So the first beat you hear, if you heard the first beat at 140, then 140 is the systolic reading. And when you hear the last beat, that is your diastolic reading. Once you're done, you want to go with one more time to verify and be sure of what you heard. Take it again high up there to somewhere like 220, then allow it to come down. When you hear the first boom, the first beat, that is your systolic reading, and the last beat is your diastolic reading. I want you to try that out. Try it, test people around you, and check what their blood pressure is. Now, when it comes to the range of blood pressure, both the systolic has a range and the diastolic has a range. And now the range for blood pressure differs by countries, because we have some really happy nations, happy countries, where their blood pressure range is really low, and we have some other countries that their blood pressure range is really high. But like I said, I'm going to maintain the standard, WHO standard, for the sake of this training. So the range is 90 over 60 to 139 over 90. I'm going to say that again. 90 over 60 to 139 over 90. So for the systolic reading, it is 90 to 139. For the diastolic is 60 to 90. For the reading to be recorded as a positive reading, both systolic and diastolic must be within range. If one of them is out of range, it is a negative reading. The only thing that will make you record this with a blue pen is when the upper reading and the lower reading are both within range. So systolic is 90 to 139. Some people will tell you 90 to 135. Some countries will tell you 90 to 120. But let's use this standard. So 90 to 139 is systolic. Diastolic is 60 to 90. So if I have a reading like 130 over 130 over 59, is that a red pen or a blue pen? It's a red pen because 59 is below range, but 135 or 130 is within range. Is that okay? So both the systolic and the diastolic has to be within range. All right? Excellent. Let us proceed. So this is called a sphygmomanometer, and this is a stethoscope, and this is a digital sphig. All right? Remember that the tube has to always go down. So the tube goes down. This comes down. It doesn't face up. This goes down. You wrap it round, press the button, and that's that. But if we are to use, let's assume this is a manual sphig. Let's assume it's manual, but it's digital actually. I put this down there. I put this in here. This part of the stethoscope has to be here. Okay? It has to be here. All right, before you start to inflate and watch the gauge. I hope we are learning. Can we proceed? All right, let's go ahead. Now the next is the pain level. We have to check the pain level of our patients to be sure they are fine. And how do we measure pain level? We use what is called the 0 to 10 pain scale. So you ask them a question and say, hello, Mr. Jones, how are you doing this morning? Please, I want to find out your pain level, 0 being the least, 10 being the worst. How do you feel? So if he says 0, that's excellent, means no pain. If he says 5 means moderate pain. 2 means mild pain, 6 severe pain, 8 very severe pain, 10 worst pain possible. So by 10, it means the person is already crying. Now, something we have detected from pain level or pain check is that somebody can actually lie about it. So someone that doesn't feel any pain can actually tell you he's having an 8. But you as a professional can tell that this is not an 8 pain. He's probably smiling. Someone that has a very severe pain will not be smiling. On the other hand, someone can actually have a very severe pain and the person will say, I'm fine. But you know the person is not fine because of their facial expression. So in as much as you want them to respond to you about their pain level, you also want to look at their face to see their facial expression. So I know a lot of persons will lie about it. I've lied about mine because I needed to be discharged from the hospital. For every night I spent in that hospital, the bills were going high. So I needed them to discharge me by all means. So whenever the doctor comes or the nurses come in and say, okay, can you help me with your pain level? I'll say 0. But one of them was able to detect I was lying. So I said 0 and she was like, oh, beautiful, excellent. You're doing well for dinner. I can see that. And she came closer to me, just a little touch. And I screamed. She was like, was that pain? I said, oh, yes, that was pain. So with my facial expression, she was able to tell that I was in intense pain, but I claimed to be on 0 level. So you need to be very observant with them, with your patients, because sometimes they can lie. Then we have respiration. Okay, respiration is basically to breathe in and to breathe out. To breathe in and to breathe out. For pain level, the 0 is a normal reading. Anything above 0 is an abnormal reading because it means they have some form of pain. Your client, your patient should have no pain at all. Your patient should have no pain at all. So anything above 0 is an abnormal reading. Then the next is respiration, the breathing in and the breathing out. Okay? When breathe in, breathe out is 1 cycle, another breathe in, breathe out is another cycle. So how many cycles in a minute gives you the reading for respiration? Okay, so and one thing you need to understand is when you just walk up to a patient and start looking at their chest, they become pretty uncomfortable. It's either they are wondering, why is he looking at my chest? Or if it's for children, you see them, they start breathing abnormally because they can see you're looking at their chest. So what you do is you distract them from the fact that you are looking at their chest. You can distract them by placing your hand over here. It will look like you're checking their pulse, but all you need here is 60 seconds. Sometimes all you need here is 30 seconds, and I'm going to explain how 30 seconds is all you need. So you place your hand here. Once you're done checking the pulse, you won't take your hand off here. You've gotten your reading, and we know you've gotten your reading, but your hand will remain there, so they will assume you are checking pulse. But you move your eyes to their chest and start checking their respiration. You make them not to know you are looking at their chest. So breathe in, breathe out is one circle. Another breathe in, breathe out is another circle, like that. Okay? So it's called circles per minute, the number of circles per minute. And the range is 10 to 24 circles per minute. Anything more, anything less is an abnormal reading. The last but not the least we're going to be talking about today is our blood sugar level. Our blood sugar level, and we use what is called a glucometer to check the blood sugar level. Now, this is a fine test glucometer. The company that made this is called Fine Test. Now, when you're using a fine test glucometer, you want to use a fine test strip. You cannot use another product strip. So the strip must be from Fine Test. The glucometer must be from Fine Test. If this is On-Call Plus, you can't use On-Call Plus glucometer on Fine Test strip. It's just like saying you can't use Samsung with a Nokia. It has to be Samsung and Samsung. It has to be Nokia and Nokia. All right. So this is a glucometer and this is a strip. Then we also have the pin for poking of the hands. We have the oh no, I don't think it. Okay, it's here. All right. So we have this to help us with our gauge. So how does this work? You have to lift this up, take this out, then you place the needle over here. All right. You have to remove this cap. You have to remove that cap, okay, to expose the pin. You need to be extremely careful when performing this procedure because you're dealing with fluids and blood. Then you cover that. Once you cover it, you see the pin very obvious out there. But over here, there's a number 5. 5 is the highest, 6 is the highest for Fine Test, okay? So 6 is the highest, meaning the needle, the pin is showing very well. So this can be used for those that have strong palms, strong thumb, right? For children, you might want to reduce it to 2 or 3. For younger teens, 4. You reduce it according to the level of visibility you want. Once you are okay with a particular level of visibility, this is like a gauge, the way you regulate fan. So once you've gotten to the level of pin visibility you want, you pull this back. Once you pull this, the pin is no longer visible. There is nothing here. You want to use your swab, what you know as cotton wool, to clean the area where you want to poke. You just place it there. Then with this orange, once you press it, it pokes. I'm going to have to poke myself for the sake of this class, right? So you just place that there and you poke. Yeah. So you poke and that's the blood coming out there. Don't worry, it's a brand new needle. So the blood is out there. I think I used 3. I should have used something 5 because my thumb is really strong. But the blood is coming out. Can you see the blood? So now, with this strip, it shows you an arrow which goes down. Okay, so you put that here. If yours doesn't have an arrow, just detects that the part that has the chip is what goes in. So you put that in and you hear that sound, right? Then you receive the blood from the top of the strip. Once it goes in, it starts reading. So it has started reading. This is how you check your blood sugar level and the results will come out. Now we have 2 types of blood sugar level. We have the fasting blood sugar and we have the random blood sugar. Fasting fasting blood sugar is when you have not had anything to eat and early in the morning. Fasting, you have not eaten and it's done very early in the morning. Why early in the morning? Because even if you have not eaten but you have stayed past 12 noon, your body will begin to convert your glucose to energy, and that is food. So that can be counted as food. So fasting blood sugar, FBS, is early in the morning when you have not eaten. But if you have eaten or it is already noon, then it is called RBS, random blood sugar. So if it's a fasting blood sugar, the range will be 3.5 to 7 mole per liter. For fasting blood sugar, 3.5 to 7 mole per liter, but for random blood sugar, 3.5 to 11 mole per liter. So some of these glucometers does not give you that range as 3.5, 4.5, whatever 0.5. So whatever it gives you, you want to divide it by 18. If it doesn't give you the normal, straight up reading, whatever reading you get, you divide it by 18. 18 is just the constant number you use, and it's going to still give you that range between 3.5, 4.5, 5.5, all the way to 7. All right, so that is how you check your blood sugar level. You might want to open your kit and use your equipment and check people in your house. Okay, so this is my alcohol prep in exchange of your cotton wool. So I'm going to use this and clean. I was supposed to clean before poking, but yes, I'm cleaning after poking. So once you're done, you put that in your kidney dish. I'm still going to explain what kidney dish means. So this brings us to the end of this class on vital signs check. I want you to practice during our live session. I will still want to see how you are doing yours. Thank you for watching. See you in the next class.